In Aotearoa New Zealand, whenever we receive health or disability care, we have a right to be treated with respect, and we always have the right to speak up if we're not getting that. Let's take a look at what this can mean. Aroha tripped in the middle of a game of touch rugby this afternoon, and she thinks she might have broken her ankle. Her mate Riley took her to the after-hours GP down the road. She's pretty stressed about it, and having Riley there is helping her feel less anxious. The GP has just started his shift. The waiting room is full, and he can see it will be a busy afternoon. He has a medical student with him today to learn too. After checking her ankle, he is pretty sure that Aroha will be fine if she takes some medication and securely bandages her ankle. Sometimes people don't get things right. What if the GP talked too quickly for Aroha to follow and didn't find out whether she was actually able to take the medication? Aroha is already on other regular medication and knows she must be careful about mixing meds. What if the GP left Riley behind in the waiting room and Aroha ended up without support when she needed it? What if he hadn't checked whether Aroha was even happy to have the medical student there, and Aroha ended up without her support person but with a stranger in the room? Aroha's rights here are about respect. The GP knows Aroha has a right to appropriate care. He needs to work out what is going on so he can recommend the right treatment. And even though the student is being trained, it's Aroha who can choose whether she wants them there. Aroha can say she needs Riley there. We all have a right to support when we are getting health or disability care. And Aroha has to understand her options because she has the right to be informed and consent to anything her GP might recommend. So Aroha can ask him to explain more clearly and answer any questions she might have. Showing respect means he must treat Aroha fairly and with dignity. Our Code of Health and Disability Services Consumers' Rights protects us all when we are receiving care. Whether we are with our doctor, at the hospital, or in our own home receiving care, whenever we feel our rights are not being respected, we have choices. It's best when we can say what we need to the person in the moment. We can ask for more information, for a support person, ask for what we need. And we have the right to speak up without fear and without it affecting us negatively. If our rights aren't being respected, we can contact them later to say what our concerns are and what we would like done. Sometimes things are more difficult. The nationwide Health and Disability Advocacy Service can help us. Their advocates will work with us and for us to help sort things out. If there is still a problem, the Health and Disability Commissioner can look into complaints with fairness and respect. Whenever we feel we should be treated with more respect in our health or disability care, we can say so. Knowing and speaking up for our rights means better health and disability care for us all.